Hi, folks. Welcome to Disability Landscape. This is Mark Knudsen, and my co-host with me, as usual, is Charlie Brose, and he gets the luxury of, we'll be introducing our guests, but before we introduce our guests, we would like to find out where people are watching us from, right, Charlie?
Indeed. First of all, we do have the YouTube channel for Disability Channel Minnesota. If you're watching from there, let us know.
Yep, and also, if you are watching us, now, you don't have to say you're watching us from your chair. We don't need to know where in the house you're watching us from. All we need is the channel number you're watching and the city you are watching it from. And if you could email that info to us at disabilitychannelmn@gmail. Once again, disabilitychannelmn for Minnesota. We're so clever, aren't we, Charlie?
Yes, all the time.
Yep, at gmail.com. So.
Yep. We'd love to hear from you. And hey, if you're watching on YouTube, make sure you hit that subscribe button.
Yeah, exactly. So why don't you then, you get the luxury of the guests.
I'd love to do it. Today, we have an old friend of mine and my wife's. He is the executive director of the Spina Bifida Association of Minnesota.
Yes.
And his name is Jim Thayer. And welcome, Jim. We'd love to thank you for coming in.
I'm glad to be here.
First thing, what is Spina Bifida?
What is it? Yes, that's a thing a lot of people don't know. So,
Right.
I've seen it, it's spinal bifida. No, it's not.
The first thing I have to say about that is definitely it's a birth defect.
Okay.
And the reason I bring that up is because in years past, it's been a while, you might get a distant relative of someone with spina bifida, say a nephew or something, maybe, or a cousin or something, and I've heard them say, my cousin has come down with spina bifida.
Oh.
And I've heard that, and not to pick on them, why should they know? And it is a birth defect,
Yeah, it's not something it's not a virus.
It's not like a cold or a flu.
It's not the allergies.
And unfortunately, it's not going to go away.
No, but I've heard that, And
okay, really? That's interesting.
I have heard it, not a lot.
No, but you have, okay.
But without question, it's a birth defect, and what happens with that is the defect happens in the first month of pregnancy. I mean, there are people that
it does?
Yeah, they have spina bifida before the mother even knows she's pregnant, And so the way it works here is, just briefly, your backbone actually grows around your spinal cord, and it actually protects it.
So the spinal cord is already, the spinal cord's already there, you're saying?
Yes, and your backbone grows around it.
Oh,
okay, so it's protected. What happens with spina bifida is somewhere on the back, like my daughter has spina bifida, and it's a lower back.
Sure.
What happens is the backbone just stops. And we don't know why. No one's ever figured out why.
It stops.
It just stops growing around.
So
there's an opening.
Okay.
There's an opening, and that opening damages the spinal cord. And and then depending on where it is on the back, well, what nerves is it affecting? Because all your nerves come off your spinal cord. And so that's just a very brief description of what it is. No one knows why it happens. We've never figured out why. I think the first time I read this not long ago, the first time it was ever even mentioned in a medical journal of some sort was we're talking 1600. So it's been around a long time.
Oh, wow.
It's just, but no one's figured out why.
I'd heard, and it could be a fallacy, but they always said, well, push folic acid during pregnancy.
That is one of the things, with medical improvements keep happening over and over and over again. And it was actually in the early 90s when I think it was the National Institute of Health, the NIH, started recommending that women in their early years take 400 micrograms or something of folic acid, because it's proven for all neurotube defects, which is what that is, it helps it out. It reduces 28% or something like that. And it's what you believe or not, because I've certainly known people that have taken folic acid and still had a child with spina bifida. So it works for some and not the other, but it's still, take what you can get. It's something. It's something.
If it's something that can help decrease the chance.
Oh, yeah, and if it does literally decrease it by 28%, good.
Yeah.
But
Right.
Who knows? But anyway, that.
And there are different types of spina
Yes,
bifida.
there's, and I'll try, and like I said, I've
Yeah,
mentioned,
because on the
I'm not
website,
in the medical field, but
yeah, because
there's-
on the website
Yeah,
it lists
yeah,
it
there's-
lists 3. I did some research, not
Yeah,
a
there
lot,
you go.
but I looked at your website, the first page.
Myelomeningocele,
Okay.
okay, and then there's just meningocele, and then there's occulta. Now, so what I had mentioned with, when the backbone
I'm sorry, I
stops-
saw those 3 names on the
Yeah,
website,
try and read them.
and I'm like, okay, I'm asking
Yeah,
tomorrow.
right. Yeah. So, with myelomeningocele, what that is,
Yeah, what is
the
it?
backbone comes down and it is exposed, and it actually comes out a little bit, and then there's more damage.
Okay.
Well, the spinal cord
The spinal
itself.
cord itself will come out a little
starting.
bit, and then there's
Okay.
more damage. Meningocele, the spinal cord doesn't come out as still, but there's still damage, it just doesn't come out.
Oh, just, okay.
Occulta, a lot of people with spina bifida with occulta don't even know they have it. It's so, like, it may be
it's-
closed up almost all the way or
Oh.
something.
But
And
it's-
so we hardly even,
It's a mild form.
yeah, we don't even know those people because a lot of them don't even know they have spina bifida. So
Oh,
it's
they
not-
don't, they're
it's
functioning
functioning. Yes.
every-
Oh, you got it. Yeah.
okay.
Yeah.
Not
Here,
until-
I'll give you an example.
Yeah.
You know who the singer John Cougar Mellencamp.
Yes.
Oh, right,
He
yeah,
has spina
yeah.
bifida. He has occulta though,
Oh, does he?
so he can still
Yeah.
Yeah, you would
he's on
never-
stage and you wouldn't know it.
Right.
That's what I mean.
Okay.
And it doesn't, of course, it doesn't get recognized until they're in for some other medical treatment, I would imagine, right?
Exactly.
Is that how it gets
Yeah,
diagnosed?
Yeah.
Because, yeah, I mean, he had like a heart attack many years ago, and he probably discovered it at that
Probably
point.
discovered it then. I don't know
Oh,
when he
right, yeah,
discovered,
right,
but he
but-
did. But
Right.
that's just an example of occulta. It's like, well,
Okay.
there's
So
still
it's there, but hardly
mild
noticeable.
So it's just a very small opening?
with occulta. It could be.
It
Yeah.
could be,
bet.
yeah.
Yeah.
Just a minor
Whereas
incomplete.
the one myelomeningocele could be much bigger, so the spinal cord comes
Right.
out.
And it's probably what my wife Cheryl has experienced
Oh, probably.
because they had to do serious back surgery on
Yeah, they
her
do. Just like
at a
with my
very young
daughter, they
age.
did the same thing. My daughter was, and my daughter's in her 30s, and just after she was born, because we didn't know anything until then.
Right.
It was the next day they sewed the back up.
Yeah.
Because if it stays open, well, then there's infection problems.
Oh, yeah.
Oh.
Yeah.
Right, yeah.
And because what happens with, when they're in the womb, it actually a sac forms
Okay.
because you still have skin, but it's open. So cranial fluid goes down and it fills a sac, and that's when I say with myelomeningocele, the spinal cord will go up into that sac. It actually comes out.
Okay.
So during birth, actually, that sac is opened.
Okay.
And so then they go in and they close it all up again.
Right.
And that's what you're talking about, Cheryl had and my daughter had.
Right. And many people's spina bifida will have a shunt.
Yeah,
That's
what-
What's the purpose
what I
of
was
the
trying to
shunt?
Okay,
think
that's
of,
what, all
yeah.
right. And so what that is, and in particular with myelomeningocele, is cranial fluid actually for all of us, it drains down your spinal cord, and it's really just absorbed into your stomach is what it happens.
Oh, it is.
But now with spina bifida, there are two things that can happen, and one is the back of your skull can be formed a little different. It's called Arnold Chiari, and if you're a doctor, you can name things after yourself.
Yeah, right.
And what
Yeah.
that does is that'll put pressure back here and close it up, and then the cranial fluid has nowhere to go.
Okay.
And so then you get what's called hydrocephalus, water on the brain. That's
Sure.
what hydrocephalus, and
Okay.
that builds up. Okay.
Okay.
Or the other thing is, and then I'll talk about the shunt itself. The other thing is when you do go in and you close up the back, you just closed up an exit for that fluid,
Okay.
and now
Oh.
it may back up.
So it doesn't have anywhere to go.
Yeah, so it doesn't have anywhere to go. And it may back up. And so then they'd have what is called the shunt, and shunts are, maybe a few decades old. They weren't around forever. So it's a tube that goes into the ventricles of your brain, and then there's a pump right back about here, and it pumps it out, the cranial fluid, and
Down
it goes
into
into
your
your stomach and then it absorbs
Just
again.
absorbs,
And it
okay.
just gets absorbed again. And so I saw somewhere where with myelomeningocele is somewhere around 80 to 90% of people born with that do have a shunt.
Yeah,
My daughter does not.
Yeah,
Okay.
neither does my wife.
Yeah,
And
see?
she was fortunate.
Yeah, very fortunate because I've known, and I know a lot of people that have spina bifida and the kids have shunts.
Sure.
They're in the hospital all the time because those shunts plug up.
Yeah,
The pump
that's
stops
what, that's,
working.
yeah, that's what I hear.
Yeah, and so- and
you
think
always
about
hear
that.
they're back in there, something with the
Think about
the
the brain
shunt.
surgery. They're going in again and putting
Yeah.
another.
Yeah, I
thing like
know.
that. Yeah,
Well,
so,
and a friend of mine has actually had the same shunt for 30, 40 years.
Right.
Oh,
right.
God.
Some will last forever, and others.
Really?
Yeah,
Wow.
another gentleman I know has had, 4 surgeries in 1 year.
Yeah, yeah, and that's I've always thought they used to make them better.
Yeah.
Yeah.
The newer versions.
Some things you kind of really
the
wonder, don't you?
The newer versions. I mean, you even have trouble going through in the airport because you go through the radar or the scanner.
Oh, the scanner.
Don't you have like a card that says I have this
You've
going
got
on?
to you've got to prove why you beeped.
Yeah.
Why you-
So
that could be an issue.
that's an
hey,
issue.
we got a beeper
We
here.
got a beeper here, yeah. So
Well,
anyway, the shunt.
the-
A lot of people do have the shunts, and they do work.
Yeah.
When they work.
What are the characteristics of someone? I mean, some are in wheelchairs, some aren't.
Yeah, well, then you talk about what are the different symptoms of it. And
Yeah,
one,
yeah,
one
symptoms,
definitely
yeah.
is the hydrocephalus, and that's certainly one of them. But that's one nobody really sees, And,
Yeah.
But the other one, certainly everybody sees the wheelchair. That's the first
Yeah.
thing everybody thinks. That's what you see. If
Right.
you see someone across the street in their wheelchair, that's what you see. You don't see everything else.
No.
But that's because there's a lot of paralysis in the legs. And I've actually heard spina bifida listed as a snowflake disease because it's all different.
Yeah, I was going to ask about that.
They can
because-
all be different. It really depends on what nerves were affected, where was the defect on your back.
Okay.
And so you'll see some people with spina bifida actually stand up and walking kind of rough,
Right.
and others in a wheelchair. Because how much paralysis is there?
Right.
Yeah, that's what I was going to.
Yeah.
So you do see some
It varies.
that
It's
are,
like a
that are
spectrum.
walking.
With-
Yeah.
Oh, no question.
Yeah.
It depends on what nerves were damaged.
No question, and so and some can walk a little. Like my daughter can walk; she can walk out to the car, but that's it. I keep the wheelchair in the trunk of the car.
Sure.
Yeah.
Some walk all day,
Yeah.
Okay.
and some are in a wheelchair all day. So it's very different. So that's one thing. Another thing, that obviously, if you're going to have troubles from waist down, you're talking bowel and bladder issues.
Yeah.
Right. Yeah.
And everybody seems to have that.
Yeah.
They're paralyzed, and
Yeah.
those are the main things that you have. Is you have the hydrocephalus, the paralysis,
Yeah.
bowel and bladder, and those are main things. And another thing that also happens with a lot of people, especially as they're growing. So we're talking younger people, because hopefully the rest of us are done growing.
Yeah.
Well, we grow
Hopefully,
out,
yeah.
not up.
Right. Yeah. Okay.
Yeah.
You said it. Definitely, we're thinking
They
it.
get tethered cord, where the spinal cord will actually tether itself to the backbone, and so you grow and it pulls.
Or does.
And the pulling causes problems, so they have to go into surgery and actually the tethered cord release, and they get it released. So,
Okay.
Yeah. So that'll affect a lot of things as you're growing, and so once you stop growing, hopefully that stops,
Yeah,
because
yeah.
there's no more pulling on it. Yeah.
Yeah, because
Now, the second level of a spina bifida
Uh-huh.
you mentioned, and that the first one you have like the open spinal cord.
Yeah.
The second one, what are the characteristics the same?
The
similar?
characteristics are the same, just not quite as bad. Those might be the ones that you'll actually see walking
Okay.
Okay.
as much more than the other ones, because there's just much more damage done in the myelomeningocele as
Sure.
opposed to just the meningocele. There's more damage done, so they'll have the same symptoms, just not the severity.
Right.
That's really,
Okay.
and then, like I said, then occulta is just a
Now,
whole leap away from that.
Right.
Do the characteristics or symptoms or how you maneuver yourself as you grow older, can they change?
They're not supposed to. It's not supposed. They always say this. It is not supposed to be a degenerative disease.
Right.
But we all know different.
Yeah.
Right.
We all
right,
know
right,
different.
yeah.
And so, yes, it can get, it is harder to get around. And you think about this, you have had a bowel and bladder, it hasn't worked for 50 years, so that's a problem.
Yeah.
Right, right,
so
right.
it's not supposed to be degenerative, but we just all know different.
But
So
there's
and-
still
and-
the
and
side
when
all
effects.
severities get a little worse. as
Right.
time
And,
goes
Right,
and you
right.
talk about the bladder control. Do many of the spina bifida people develop like infection issues?
Yes,
then?
they do. That is a common thing for bladder infections. Is very common because if if it's paralyzed
Yeah.
and you're not emptying totally,
Right.
the remainder can become infected.
Sure.
And what we see is, I talk to a lot of parents, and they can see it in their kids when their eyes get a little bloodshot, or they're not looking well. And it's like they have an infection.
They're seeing the early symptoms.
You're seeing early symptoms of a bladder infection.
Well,
and
and
so you get to know your
kid.
But they can't tell.
Kids don't tell. No, you're
Right.
You're
I mean,
paralyzed, you can't feel it.
Right. That's like with me.
Yeah.
The only way I deal with bladder infections.
Yeah.
And I can't tell until, okay, my temperature is now.
That's just it, because you can't feel it. I mean,
Right,
the
I
other
can't
thing-
feel it,
you
so
can't
what's the
feel it.
temperature?
The other thing is
Once the
if you're
temperature goes up.
paralyzed from the waist down,
Right, like-
and let's say you go to a swimming pool, what about your feet? Did you burn them? Did you scratch them? Did you
Right.
scrape them? What did you do? I don't know.
Yeah.
They can't feel it.
Right.
Exactly. Right.
So
We've-
they'll put
I've known people that have
shoes
gotten
on. Yeah.
in a bathtub, and unfortunately, the faucet was down by their feet,
Oh, it's hot.
and they turned the
Yeah,
water
it's
on and
yeah,
hot,
yeah.
and it burned. them.
Those are things where you need advocates to help you with those sort of things. Everybody does. Everybody.
Well, this guy was an adult, and he was just some. You
Yeah.
don't. You're not thinking at.
No,
You're
no, you're not.
thinking at times. I know, because I coached the junior wheelchair basketball
Oh,
team
sure.
at Courage
Center?
Kenny.
Courage.
Back then, Courage Center. So
Yeah.
I'll probably call it Courage Center, right? Courage
We
Kenny.
all do, yeah.
But I know we had a handful of kids, spina bifida.
Right.
And with spina bifida, it also kind of affects cognitively because they,
It's hydrocephalus.
because they weren't slow,
No.
but they couldn't remember,
They couldn't, and a lot of that,
remember or quickly.
like I said, is the hydrocephalus, that water pressure on the brain.
It's like they
is-
could do step 1, step 2, but once it was 3, 4, and 5,
Yeah,
it was tough.
Another issue with that cognitive is, for some reason, people with spina bifida are not good at math.
I was just going to mention
Oh,
that.
really?
They're not.
No,
Math is
they hate
very
math.
Math. I remember my daughter having troubles with math when she was in school. But math is very 1, 2, 3, very forward, and
Okay,
their brains
okay.
don't work that way.
No. No.
It's very difficult for them to do math.
My wife had to take algebra twice, and
Yep.
she hated every minute
I
of it.
bet she did. My daughter had troubles too.
So is it more kind of like a learning disability?
It can be.
It can be
Yes,
in a way.
In particular, and that's also where you find out sometimes when the shunt's not working.
Is when
They're having trouble in
Oh.
school.
more trouble, yeah.
They're having trouble in
because
school.
it's not draining and it's affecting
There
them.
must be some pressure.
Oh, I hadn't even thought
Now-
of the thinking side of it.
Yeah.
More and more adults with spina bifida are getting older and older, and it's something that the doctors are not used to.
They're not. No.
Unknown territory.
Yeah.
And so, is there more research
Yeah.
into helping adults with spina bifida as they get older to deal with whatever may be happening?
What you're seeing now is more spina bifida adult clinics than you ever saw before.
Okay.
And that's because all of our kids, there seems to always have been, the children's hospitals
Right.
doing clinics for the kids, but what about once you reach 18 and you're no longer a kid?
Right.
And now
Yep.
you're seeing more and more adults. My daughter goes to one. She goes to one over in Gillette Hospital, and they have an adult clinic. And they work with adults with spina
Yeah, because they're
bifida.
doing that with
Yeah.
polio too. A lot
Right,
of
they're
these
doing
different
that, yeah, because-
disability, because we're all living
Well,
longer, even us
medical
disabled
science
people.
is forcing us, whatever word you want to say,
Right.
we are living longer.
Yep.
And now we have to deal with that. And so you're seeing more and more adult clinics. And so, yes, they are starting to deal with it more.
Right. Living longer, that means longer years we have to put up with the Vikings.
Yeah.
I'm afraid
Okay,
so.
I'm sorry, I had to just
Well,
throw
you
that
know,
in.
Just an aside,
I've always
right?
thought about, think about this is, with medical science, we've got to the point where now we got more adults. Well, what is it going to be 10 years from now?
Right.
Medical science is just going to keep going and going.
Right.
It's like,
Right.
wow.
Yeah.
Yeah, so,
Yeah.
Now the association,
uh-huh.
what are your focuses? What do you
Yeah.
I mean, is it child services, adults?
Yeah, it's. I'm going to say there's no question. Just like living longer, it used to be more towards we'd work with parents of younger kids, but now they're older, and and we do
Yeah.
even have a Facebook page for adults with spina bifida, and so we're seeing that more and more. So we're just aiming things towards everybody. It's hard to cover everybody,
Yeah.
but but
Right,
that's
right,
what you
right.
that's
Yeah,
what you have
yeah.
to do now. And so, yeah, we want to make sure that everybody's involved, and and we've started up different programs right now. With the pandemic, you almost have to talk pre-pandemic and after.
Yeah.
Because we've changed so much.
Right.
I mean, it used to be we could do. I remember doing like we called teen conferences. Where we'd have teenagers stay overnight with Spina Bifida stay overnight at a hotel, and we'd do service. We can't do that anymore.
Yeah.
At any conference really. So we're doing them slowly,
because-
bringing them back.
yeah,
And
because of the pandemic.
so we were even doing a lot of. We help with camp. They go to camps. Camp Courage. There was Camp Courage, and there's another one called Spirit Camp, which is run by I think Sanford Health in South Dakota. And we would help pay for that. Well, those got canceled during the pandemic.
Yeah.
They're just starting up again, and we'll help with camp. But we also started this what we call Be Active grant. So whether they go to, and you talked about the wheelchair basketball.
Right.
So you might get some of our kids go to wheelchair basketball. We call that an activity. The idea is get them out of the house. Because
Right,
too
some
many
kind-
people,
exactly.
Too many people with disabilities just sit at home.
Right.
They just sit at home. So the idea is get them out of the house, and we help them pay for those things.
Okay.
Yeah, because with our basketball,
Yeah.
what was great about it, for a lot of the kids, it was their first time being involved.
Exactly.
And then we would go overnight at Camp Courage and be in a tournament. It's the first time
Yeah.
they ever stayed
It's
away
amazing.
from mom and
I've
dad.
seen-
So
yeah.
it's very key, like you said. You got to get the
Get
kids
'em out of the house.
Doesn't
And
matter.
it's
disabled or
fantastic.
not. Get them out.
Get them out. I've seen some. It's amazing. I've seen some. Well, the basketball, but I've seen one that was taking archery.
Oh, right. Yeah,
Archery
whatever sport. Yeah.
and karate.
Or, yeah, karate. Right.
And
yeah.
so we're just
Floor hockey.
Yeah.
Yeah.
Just get out of the house.
Yeah.
Go
Yeah,
do
right.
something.
Just get out into the
Right.
public and do something, and we'll help you do it. And so our focus has changed since the pandemic. We got to get them out of the house.
Right. It's getting.
The camps are starting again, very slowly.
So,
Right.
annually, and I'm sure we probably put on hold during the pandemic, you have the run, walk, and roll.
Right. Yes.
And I've been not a participant, but I've witnessed it.
You were there a couple weeks ago. Right?
How many people do you draw?
Yeah,
during that?
and I almost have to talk pre-pandemic and now, and right now, when I think I did see you there the month ago, whenever we had it.
Was he moving?
Yeah, we had about we
Barely.
It's like herding cats, and so it's kind of you saw it, but about 250 people.
Sure.
As opposed to before the pandemic.
Yeah, before the pandemic.
I was ordering T-shirts. I was over 400.
Wow.
Oh, were you really?
But it just dropped off.
But
Right.
it,
Oh,
it
yeah.
may grow
It's
again.
coming back because in 2021, I'm going to say it was about 200. So now we're at 250, and
Okay, so
it's
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 good.
coming back.
Yeah, it'll come.
Yeah.
Now, October,
Right.
when people will be seeing this show,
Yeah.
it is Spina Bifida Awareness Month.
Right.
I know that you get a bridge lighting,
Yes.
the 35W bridge,
Oh, do you?
October. Oh, I said before you go for it, October 22nd.
October
Okay,
22nd.
yeah.
For the bridge lighting?
Right.
Okay.
And are there any other activities or events that you've put
Well,
together
right now,
in recognition?
yeah, right now what we're doing is, there is the bridge lighting, but so that, I mean, and that I think it's yellow, but you're only given so many color choices.
Oh, really?
And I believe it's yellow. And what I need to find out from the city of Minneapolis, I mean, this is their bridge, so I can't really do a lot of advertising on their bridge and see
Right.
what advertising are they willing to do. Because if someone sees the yellow, it's like, well, what does that mean?
Yeah.
Right,
And
right,
so
right.
anyway, but that's one thing, and that's always a good thing in October. We are looking at possibly, bowling. Get this, bowling. We did this a couple of years ago, bowling and painting, where we get a room in a bowling alley and they paint,
some
or
painting.
they can go bowling.
Okay.
Oh.
They can do it. You
Okay.
have to
I
do it
thought maybe you
both.
could do it all
How
on
do
the.
you do it? Yeah,
I thought you were going to do it all on the
I'm not
lane.
that good. No.
Yeah,
and
one
whatever
lane
they-
bowling, next
yeah.
lane would be painting. I
And
was
so,
like,
what we do is we'll get them the canvas and the paints and
there you
everything.
go.
And then, we had brought a lady in that does this. She teaches a painting class for people with disabilities, and she does this.
Okay.
And she'll get them painting a bird or something. And then bowling, and because people with disabilities can go bowling, you put the bumpers in.
Yeah, put the bumpers
which
in.
helps me a lot.
Right. Yeah, they're for the disabled. Yeah,
Oh,
really. Yeah, we
Or
know.
they have the ramps. You can just put the ball in the ramp.
Yeah,
and
the
goes
ramp, and it goes right
and
down.
So we're looking at that. All I'm saying right now is around the end of October.
Okay.
And that's just again get them out of the house. But
Yeah.
we always look at everything as a support group. I learned this from a lady down in Texas many years ago. I was down at a conference for Spina Bifida, and she was talking about it. She says, I don't care what you do. You call it bowling, you call it a picnic, you can call it a run. All it is a support group.
Yeah.
It's people of the same mind getting together.
Yeah.
Right, right.
And so it's really just getting them together.
Yeah,
So-
exactly.
Is there a reticence with some of the parents for kids with disabilities in letting them get involved?
Yes, and this is where I ran into that. And when I was doing that teen conference, I did not always have to convince the teenager to go to the conference. I had to convince the parents that it was okay for their teenager.
Did you really?
Oh, you bet, because some parents like, you're going where, you're staying where, you know, and
really?
there's no question
That's interesting.
that when they're little kids and it's mom and dad's, they're in charge.
Well, but you're a teenager, it's a lot different.
It's a lot different.
You
and-
want a little more freedom.
Yeah,
Yeah,
'cause
you would-
with
you
our
would think-
basketball,
Yeah.
the parents were like, take them.
Yeah, I know, and
Take
we
up.
had a lot of parents like that. But
Right,
then
but-
there's
but
a
they're-
lot that you didn't take.
You did, yeah.
that,
Well,
you know,
and
yeah.
you know, at the high school age, and there's a number of districts that offer adapted sports,
Right.
and a lot of the coaches say it's impossible to get parents to let their kids play.
Yep.
They're afraid of them getting hurt.
Yep.
And
Yeah.
and it's like you have to let go.
Yeah.
You have to let them be hurt.
Yeah.
Because it's part of life. It's
Well,
part of growth.
Yeah. The one thing we've heard from parents in the past, and it is with basketball. Well, you know, he's got a shunt. What if he gets hit in the head with the basketball?
Right.
Well, I used to hear that, and so they wouldn't let him.
Yeah,
It's
yeah.
dangerous.
Right.
They didn't let him play. It's like, well, put him out there. I mean, we're all going to get hit in the head.
Yeah,
with
because I
basketball.
I just coached them. I was like, it's
Yeah.
for the other one.
Yeah.
The other one. I mean, yeah.
We're all going to get hit in the head with a basketball
right,
eventually.
right, right.
You know?
Yeah,
So,
exactly.
yeah, but,
So-
yeah, so I've always found when you're dealing with these younger kids, you're dealing with the parents.
You-
of the
you
other-
Right.
as much as anything.
Yeah, yeah.
Yeah.
So,
And
yeah.
that's a shame.
Yeah.
Yep.
Well, it's time to wrap it up.
Oh,
Jim, we want to thank you for
Time goes
coming
by
in.
fast.
yeah.
Any final words?
No, I mean, it's just watch for,
Website.
When you talk about Spina Bifida Awareness Month, and,
Yep.
not everybody is aware of Spina Bifida. We certainly are because we live in that world, but that doesn't mean someone out there that doesn't have Spina Bifida in their family.
Right.
Why would
Okay.
they know?
Yeah.
They've got a life to live. So that's what Awareness Month is. So the next time they see something, they see a run that we're going to do, or even a bowling or something like
Yeah.
that, or who knows what, or they see a bridge in yellow, they say, oh yeah, I know what Spina Bifida is. That's the idea.
And then the website?
And the website, we're going to get that baby fixed up.
Okay, but in the meantime,
yeah,
what
it's
is the website?
mnsba.org, Minnesota Spina Bifida Association. So
right.
mnsba.org.
.org.
Yes. So.
All right, Mark,
Well, thank you, Charlie.
let's wrap this up.
Yeah.
All right.
Thanks for
Go ahead.
watching us. Want to thank Jim Thayer, my partner Mark Knutson. I'm Charlie Brose. You've been watching Disability Landscape. We'll see you next time.